Hello everyone, my name is Alexa Yella and I'll be talking a little bit about myself, my career, my goals in regards to my leadership. I am doing this for my Capstone 1 class. So first, let's talk a little bit about me. So I grew up originally in a little town in Mexico close to Monterrey. After 7th or 8th grade, we moved to the United States due to job opportunities with my dad. And again, most people know the crime in Mexico is not really ideal. So after we moved here, I decided to do my EMT in high school, my senior year. After I graduated high school, I went through paramedic school and then continued my studies. While finishing paramedic school, actually, I started taking more of my classes to get my associates. And then I transferred, and now I'm almost done with my bachelor's degree. When I became an EMT, I originally actually wanted to be an anthropologist due to the history and medicine aspect of it, but then changed my mind and decided to go more of the medicine route, and that's why I became a paramedic. I was lucky enough to be able to take about a year's worth of AP classes my senior year and junior year of high school, so that helped a lot, and that's why I'm kind of still in track with getting my paramedic and my bachelor's degree within that 4-year-ish span. So that helped me out a lot, maintain a good timeline for progress and give me enough time to learn. I originally worked for a volunteer department, Westlake Fire Department, and then now I'm working full-time as an in-charge paramedic for Cy-Fair Fire Department, close to the city of Houston. Some of my hobbies I enjoy doing is dancing, yoga, rock climbing. I'd rather be doing things outside the treadmill. That's just kind of what I do. I also enjoy traveling. Recently, I just came back from Paris and Turkey. I really like the historical traveling sites, so I really enjoy all of that. A little bit more about my career. As a paramedic, I've been doing this for around 2 years full time. I originally joined the department as a brand new baby paramedic. I went through around 6 months of training where they saw my clinical and operational skills. Basically, I learned how the department works down from the ground up. Basically, how does an EMT work? How do I work? How do I work with the firefighters, with the other office staffs? How do I work with the hospitals? How do I drive an ambulance? What's the proper way to do different things? After a 6-month process, I became an attendant, which is an A3 level paramedic. So I can do basically about 80% of the guidelines at that level. And guidelines are basically the procedures that a physician allows us to do. Now, after around a year working there, I became an in-charge paramedic. Now, as an in-charge paramedic, I have more of a greater scope. I would say around 80-90% of the guidelines now. So a little bit more now as a P1, which is the in-charge paramedic. Now I am able to do more of the guidelines, more procedures, more medications, so I'm able to help my patients a little bit more. Most ambulances will have one in charge, and then depending the availability at that point, whether it's a basic or another in charge or another paramedic. Now, as an in charge, usually when someone calls 911, ambulance arrives, that in charge is in charge of that call. And I'm also in charge of the ambulance. If something happens, maybe, hey, we didn't check the tire pressure or we didn't check something and something's missing, then it's going to be on me. It's going to be my fault that I didn't report it, or I'm the one responsible for it. This is also the case for narcotic medications and for critical incidents. So for critical incidents, usually I will be in charge of basically guiding the rest of the response team. So whether that be 2 fire trucks and like 8 firefighters, my supervisor, law enforcement, it just depends what the call is. But that will be my responsibility. Basically, I become the leader of that call, and I have to lead whether it be 1 person or 20 people at that point and handle the incident. I'm lucky enough to have a really supportive department. So I have a supervisor who at any point I can call for assistance, whether it be clinical or operationals. Sometimes it can be I just need someone to help because it's a very chaotic scene, or sometimes I need their clinical advice. After my supervisor, I do have other hierarchy all the way up to a fire chief. The fire chief is the person who basically oversees both EMS and fire department. Now, in my current role, I would say I'm in the beginning stages. I have only been an in-charge paramedic for around a year. On this side of my paramedic journey, I am also a manager and instructor at a small business called Health Street, which is another part of my leadership journey. On this side, in the Health Street side, I have taught, I would say, over 100 classes. We basically have 2 to 3 classes a day, Monday through Saturday. We have a staff of around 20 instructors part-time that we kind of rotate based on their availability. They teach CPR, ACLS, PULSE, and Heart Saver. So these classes are made for both healthcare workers and lay workers. So CPR and Heart Saver, anyone can take those classes, versus ACLS and PULSE, those are usually more for nurses, physicians, and paramedics. They involve basically a standard of care for cardiac emergencies, airway emergencies, and CPR emergencies where they need to resuscitate that person. So this is based on the American Heart Association, which we're a training center for. So we can make our own CPR and ACLS instructors, and then we can also have independent contractors that teach their own classes, and we sell them their certificates that they give to their students, because we're a center versus just a site. It's a big hierarchy around the American Heart Association that trickles down into the instructors, but I have managed that for around a year and a half as well, where basically I handle scheduling, class paperwork, the American Heart Association Training Center and their independent contractors and our instructors, basically just the business aspect of it. But I have also taught, it helps to teach others, and I have built many connections that way, many physicians that work in the different hospitals in the Houston area that has significantly impacted both my knowledge in clinical care and patient care, and also my professional side of things, that many of them have a lot of businesses that they run. There's a couple of physicians that actually have 2 or 3 clinics that they run as well. Now, some challenges that I face is due to my age and my beginning of my journey. Sometimes it's very hard to make those connections just because I'm not exposed to them yet in some aspects, right? As I grow my career in both Health Street, the private side, business side, and my paramedic journey, I'm able to build more connections. I've been going to conferences, learning more about other people, and then going into more classes, teaching more classes with physicians that they request, and able to make that higher connections. Another challenge is about me. So I like to say that I'm very passionate and that I like to go very fast. I like to do things as fast as I can do them right. But sometimes I've been kind of the challenge is that I have to accept that sometimes you're not able to speed through. You have to slow down to do things right, and you have to slow down to let yourself have the time to do it right. I am lucky to have been able to do this program because it has taught me a lot. Specifically, 2 classes have really made an impact in both my life and my career. One of them being ethical leadership, or ethics in leadership. As a paramedic, it's very important for me to give that ethical patient care when I go to patients' houses and treat them on really horrible days in their life. And then it also, the way I lead others. As an in-charge, I have to talk to all these people in a good, moral, ethical way. And what I say can impact someone's life. So that has significantly kind of opened my mind up to how important it is, the things that I say and that I do. The other one is data decisions. So basically making decisions based on data. As a paramedic, again, science-based medicine is very important. So right now in our ambulances, we're able to give whole blood and a lot of medications that other ambulances are not able to, just because how ourselves as paramedics and our leadership are able to gather the data from other sources like physicians, hospitals, other departments, and build a good case to add a medication that we deem necessary to provide better patient care. So those are 2 great things that I've learned in this program, how to make better decisions using data and ethics. I had a very busy high school career that allowed me to get really good with time management. I was part of the band, the dance team. I was taking an average of 3 AP classes junior year, 4 AP classes my senior year, and still doing the band and dancing. And doing my EMT program my senior year as well. So I've become very good to time management. Even now, I work full-time at the fire department. I am also, I work as a manager on my side at Health Street. the small business, and I'm doing this program on the side as well. So I'm pretty good with time management. I like to do things by priority, so I usually like to prioritize everything. Another thing is that I've gotten very good at writing just over the time of this course, and again, my previous experience in high school doing my AP classes. I have not taken a college course in English, but I've taken multiple courses that were basically essay based. Like I think the previous 3 history classes I've taken, they were all essay based, discussion based. So I have built a strong foundation there, and I was lucky to have really great teachers in high school that really opened my mind and made a good English foundation. In some aspects I might struggle, especially because of my English. So sometimes, since English is my second language, I like to prefer my writing than speaking, just because that just comes naturally. Again, I'm a little more conscious about my speaking English. But I would say I'm very proficient in both writing and time management. I would appreciate some leniency when it comes to writing. Sometimes my grammar might be a little off as I base my Spanish format or the way I structure words. So sometimes that might slip up just because it makes more sense in my mind the way I would word it in Spanish than in English. But overall, I'm very excited for this class, and I have learned a lot throughout this whole program. I'm very appreciative of all that has taught me, and I've seen it work when I go on shift and see patients, because it has made me a better paramedic, a better person, and a better leader. Thank you.